I want to have another chat about Lindsay Clancy and the situation surrounding her case, just obviously based on the criminal court case at the moment. She's got a civil lawsuit, so does Patrick, against a lot of the providers that are actually called to witness in her criminal case. Now those civil findings are going to be about the standard of care. And I made a brief video about the Judge William Sullivan actually mentioning this in court in front of the jury. And generally, a jury isn't allowed to know, just say the defendant has been through one court case already for another murder. They're not allowed to mention that to the jury. And it's the same with, are they bringing a civil case? The jury shouldn't know about that either. And it's possible that Judge William Sullivan has put into the proceedings a reason for a mistrial. But anywho, so I want to talk about the power threat meaning model, okay? So this is something developed by Dr. Lucy Johnston in the UK, and she's been all around the world since 2018 talking about this, and it was one of the most interesting courses that I've gone on, just a little, just basically open discussion with clinicians and things like that to talk about this power threat meaning model. And it's so interesting, but it's confronting for people, for institutions and things like that, to start changing the way we think about diagnosis and cause and healing and that sort of thing. So power is what's happened to you. So it's what is in your life. So it's everything from ideological power operating in your life to the interpersonal, to economics, biology. Okay, so what has happened? So think about power and what has happened in Lindsay's life. Getting sick, okay? Threat. So how did this change in power or these things happening in your life, how do they affect you? So what kinds of physical, emotional, social threats did this power imbalance impose? Because it's always about a power imbalance. And psychosis is a response to this model, okay? So the meaning, it's about what sense do you make of it? What meaning do those experiences in that situation hold for you personally? And then the threat response is, what did you do to survive? So how do responses like hearing voices, holding unusual beliefs, how do they act as protective, adaptive reactions? And then the strength and story. What are your strengths and personal contextual story? What did, she talks about calling it how does she explain it? Like a narrative, it's, so if you think of Lindsay Clancy, traditional treatment, okay, so illness equals pills. Now those pills, what are they supposed to do? Just support her to stay in the entrapment of her current narrative that made her feel unwell in the first place? To stay just struggling on. This is what happens, and we've got to reinterpret. So, Lucy says, it's a reinterpreting psychotic experiences. So hearing voices, externalized reflection of critical, overwhelming, or dominating relationships and power dynamics, rather than just, a random neural glitch. Now, these voices and sounds, they are created by our tired bodies and the interpretations that our brains will make. But what they say is a reflection of what's going on in your life, obviously. So paranoia, unusual beliefs. So they need to be reevaluated as logical extreme attempts to make sense of a terrifying or unsafe world and to regain a sense of agency or protection. And, you know, that's what I've said psychosis is. It is escape from something that is unsafe. Now, it might seem to go into something that is dangerous and terrifying, but it's taking you away from the real threat in your life. So it's about moving beyond the medical model, rejecting the promise of chemical imbalance, or, you know, this sort of psychiatric disorder, you know, focusing on social inequality, focusing on trauma, focusing on, you know, the social determinants of distress. And we know chemical imbalance, that is BS. Depression isn't chemical imbalance. We need to just get over that. That is some bullshit sold to us by the pharmacological companies, making billions of dollars off people that they're selling these drugs to. Now, it's not to say that some drugs don't have a place, but this is what is often very controversial to people about this sort of model, you know, because we've got a model at the moment which is medical illness, give them pills, and we're not questioning the framework. You know, these pills are supposed to make, let's say, you know, a mother stuck in some sort of religious, like, you know, like Andrea Yates, okay, she couldn't escape that evangelical Christian framework of her life where, well, you just be a wife, be a housewife, and you have plenty of children. You have as many children as God will give you and your husband. You know, and Rusty was down with that. You know, it was only 7 weeks after Andrea was expunged from hospital with the strict instruction to not get pregnant. It was super dangerous. 7 weeks later, she was pregnant with baby Mary, okay? So, you know, we've got to question the framework. So, you know, the chemical imbalance is debunked. It's disorder versus struggle with our lives. You know, so it's what's wrong with you versus, well, what's happened to you? So it's those diagnostic labels versus narrative, you know. So, you know, and often something like CBT will be brought in, right? And I don't know. That's not going to work on a lot of people, I don't think, even though it's a technique that became very big with counselors and things, cognitive behavioral therapy. You know, just think better. I mean, think of Lindsay Clancy's affirmations. Today I'm going to feel fit, well, confident. Today will be a good day. Today I can cope. Today I don't think about all those things I don't need to. I'm just going to be in the moment and everything's going to be sunshine and rainbows. Imagine how devastating it feels when you're making these affirmations and they don't work. Now, yes, and something I'm told often is, you know, your thoughts create your reality. Thoughts create your reality, you know. Stop giving yourself negative thoughts, you know, stop talking down to yourself, sort of thing. And that's true. But I think, you know, to heal Lindsay's life, no, affirmations are not going to heal Lindsay's life. And this is still leaving the weight of everything solely on Lindsay's shoulders. So, you know, what are some of the realities of this? You know, the impact of not having enough money to live on. Now, okay, Patrick was earning a good amount of money, but Lindsay was stressed about money. She was concerned about losing her career, maybe losing her footing. the stage she was at in her career. Perhaps after working for 7 years there, she was, as a lot of women might do, putting aside the opportunity for advancement and things like that. Not having, some people, it might be that they just don't have enough resources to feed their family. They are struggling under, worldviews. This is where the ideological power imbalance comes in, the assumptions, the principles, the ideas we all take for granted about what success is, what failure is, what a family should look like, what a marriage should look like. And, a lot of these things were really affecting Lindsay Clancy. And, she was told to go to therapy. Is therapy any good if you're not going to really open up, or you don't feel safe, or you're not telling the things you need to tell? And obviously then it does come down to observations, but still there's limitations. Okay, so what Dr. Johnson's saying is power is missing from the diagnostic and the psychiatric understanding. So what did I write here about BPD? So expert judgment that you have an illness caused by bipolar disorder or clinical depression, or a personality disorder. It's completely illegitimate and damaging. And we've got to understand the impacts that all sorts of things happening in people's life have on their mental well-being. If you're feeling like you can't hold a job, when people are unemployed, they're excluded from society. And when they're abused, they're not taught to throw the responsibility back at the abuser. It's about, well, what did I do to be abused, sort of thing. And I think it's interesting to think about Lindsay Clancy as entrapped in a narrative, because there's a lot of criticism and about her having had, but she had the perfect life, a loving husband, this beautiful young family. She'd managed to have a, begin a career. She was living not on the poverty line. It's like as if these things exclude you. It's about what Lindsay felt as she was having children. Now, she, to some people have brought up that, like PD, for example, that she, she just didn't have the personal insight to understand that she should have been making different decisions about her life, about children. But she's married to Patrick Clancy. He wanted children. He wanted a young family with her, obviously. There's a lot of pressure there. She was putting pressure on herself. The labour and delivery nurse who should, what a dangerous word, want a young family, want a family, and maybe a large one. And, it'd be like with me, I don't know, I couldn't cope with the chaos of like lots of little children around me. I mean, if I was a parent, I think, one would have been the perfect quota sort of thing, because if you're a person that you feel like you can't think straight and you just need a lot of time to think, or if you're not that easygoing, if you're a bit neurotic and that sort of thing, I mean, you've really got to know thyself. And Lindsay's trying to live an ideal life, and this this life dictated by this is about what the world is telling people should want in her position, right? So very interested to know what was recorded in both of the intakes when she went to the MGH, and then what was recorded when she was transferred to Maclean. She wasn't in Maclean under a Section 12, So she's gone there by volition of her own, and she's on a Section 10, and that's why she could discharge herself. Now, did Patrick push strongly enough for this? I mean, Cora's birthday had already been and gone anyway. She didn't want to get back for Cora's birthday, but just to be present for the, the trampoline place party or wherever they went, and maybe thinking too much of the optics of where's Lindsay, and wanting to just appear to be stable and normal and everything's fine, and that's not right, because again, it's that suppression of real threat in Lindsay's life. She was under stress, and she left too soon. I want to know why Patrick didn't fight this, why he kept leaving her alone. She must have driven him crazy with how he could just continue on with his life, his lifestyle, maintaining friendships really well, and going to brunch and going skiing with the kids and things like that. And he maybe there's the angle that he didn't want Cora to be not having these experiences and missing out because Lindsay was going through something. But it just really, I think, it just does not validate Lindsay's feelings at all, and she was really struggling. So I written here now? Oh yes, now that's right. So I wanted to just say in this book, okay, so it goes through, it explains, it's just basic, but it explains depression, it explains signs and symptoms of major depressive disorder and things like that. But it'll tell you, and this is all just from a first aider perspective, okay? But the thinking, frequently being self-critical, worrying, being pessimistic, impaired memory, impaired concentration, being indecisive, feeling confused, thoughts of death and suicide, feelings of sadness, anxiety, guilt, anger, mood swings, lack of emotional responsiveness. Lindsay was feeling blank, wasn't she? Feelings of helplessness, hopelessness, and irritability. And these are things that Lindsay was describing. She was describing depression, behavior. I'm not sure if she had crying spells, but, Patrick, if he could have a skerrick of honesty, could probably tell us these things, but anyway. Withdrawal from others, neglect of responsibilities, loss of interest in personal appearance. I think with motherhood, you're not having time in front of the mirror to put your makeup on and things like that, right? But yeah, there was a marked difference in Lindsay Clancy's appearance before and after the birth of Callan. You can see that very clearly in photos. Her self-care was waning, but busy. People are busy, okay, and priorities. Sleeping too much or too little, using drugs and alcohol. Lindsay did report drinking alcohol. She reported drinking the recommended maximum amount of 1 to 2 drinks per night. But the physical is chronic fatigue, lack of energy, loss of appetite. She was losing weight. She lost 15 pounds. Constipation, weight loss or weight gain, headaches, irregular menstrual cycle, loss of sexual desire, unexplained aches and pains. So when you're breastfeeding, menstruation is halted. You stop breastfeeding, you menstruate again. And as we know, Lindsay was weaning Callan from quite the young age of 4 months. She was concerned about that. That really weighed on her mind. She felt like a bad mother, like she was denying her baby something that he deserved and was his, and something that probably Cora and Dawson had, and that's her breast milk. But, with the drugs and everything, the pharmaceuticals, she was anxious about that, fair enough, and so didn't want to pass anything through to breast milk. Zoloft, in the amounts that were prescribed at first, was considered, quote, end quote, safe in those in those amounts. But as she moved through her drug journey, so, and then it mentions, a little bit about bipolar disorder, the mood settings and the depression that can come with that. So, and perinatal depression. So that's occurring, in a woman at a time around childbirth. So the depression can either occur before birth, which is the antenatal depression, or after, which is postnatal or postpartum. Those terms are used. So feeling sad, having the baby blues after giving birth is common, but when these feelings last for more than 2 weeks, this may be a sign of depressive disorder. A woman's hormones, everything has to recalibrate in the body. What's often overlooked for people, and I wonder what blood testing Lindsay had done, just about general levels of things like iron. You lose blood giving birth. You are vitamin depleted. New mothers' hair often will fall out. It might be extremely beautiful and thick and glossy when you're pregnant, and then it can fall out after giving birth with the stress on your body. This should not be underestimated. So the symptoms don't offer, they do not differ from depression that people experience at other times in life. However, depression at this time has an impact not only on the mother, but on the mother-infant relationship and on the child's cognitive and emotional development. This is coming down to attachment theory, isn't it, I guess? For this reason, it's particularly important to get good treatment for postnatal depression. Treatment not only helps the mother's depressive symptoms, but can also improve the mother-child relationship and the child's cognitive development. A national survey of Australian women 6 to 8 weeks after childbirth found that 7.5% of them had a major depressive disorder. Factors that can contribute to this are hormonal and physical changes, and the responsibilities of caring for a baby and having had a previous episode of depression also increases the risk. With bipolar depression, so it just says that, bipolar disorder treatments are, psychoeducation, medication, psychological therapies, family therapy, and obviously, everyone needs to be involved, right? So generalized anxiety, mind my voice, I just can't get rid of this croakiness, can I? I've been using lozenges and things. I'm feeling a bit better though. Anyway, stop making it about me. Generalized anxiety disorder, so GAD, this is something that Lindsay was diagnosed with. So some people experience long-term anxiety across a whole range of situations, and this interferes with their life. These people have generalized anxiety disorder. The main symptoms of GAD are overwhelming, unfounded anxiety and worry about things that might go wrong in one's ability to cope, accompanied by multiple physical and psychological symptoms of anxiety or tension occurring, more days than not for at least 6 months. People with generalized anxiety disorder worry excessively about money, health, family, work, even when there are no signs of trouble. So the anxiety appears difficult to control. Other characteristics can include intolerance of uncertainty, belief that worry is a helpful way to deal with problems, and poor problem solving. Generalized anxiety disorder can make it difficult for people to concentrate on at school or work, function at home, and generally just get on with their lives. And then psychosis, so what is psychosis? It's a general term to describe a mental health problem in which a person has lost some contact with reality. There are severe disturbances in thinking, emotion, and behavior. It can severely disrupt a person's life, relationships, work, and other usual activities, and self-care can be difficult to initiate or maintain. Psychiatric disorders are less common than other mental illnesses, affecting around 0.45% of adults in any 1 year. There are numerous disorders in which a person can experience psychosis, including schizophrenia, psychotic depression, bipolar disorder, which can involve psychotic depression or psychotic mania, schizoaffective disorder, and drug-induced psychosis. And there's some talk about, what has caused psychosis for Lindsay Clancy, if that's what she's experiencing. What we do know through the civil suit, and I've just tried to keep that separate, but and look at the arguments in court with what they are, with the information, with the events as they were in reality at the time of these events. So I'm not saying this properly. So for example, what I'm trying to say is Lindsay Clancy was not diagnosed with bipolar at the time of the murders. Now, the question is, for the civil suit, was the standard of care lacking? She should have been diagnosed. She's now been diagnosed. So in September 2024, she was diagnosed with severe bipolar disorder. But the question is, why? Was it because she wasn't disclosing enough? And, because it does, as I've said before, and it's the term used, and it's funny because it's about the moon and lunatics, isn't it? It waxes and wanes. And, I can definitely confirm that. And, I've lived through psychosis that I had for extended period of time, severe mental illness, and been working and going through life, and you can do it, but there were times when it was so clear I was so unwell, and it's just so difficult to get out of and get help. And in the end, anyway, it's not about me. So people usually experience psychosis in episodes. An episode can involve the following phases, which vary in length from person to person. So pre-morbid, so this is your at-risk phase, when the person doesn't experience any symptoms but has the risk factors for developing psychosis. Lindsay had the risk factors for sure, and some people are of the mind that, because she had the risk factors and then was expressing these deep, this dissociation from life, or the numbing, or and the symptoms that she was openly talking about, they should have thought more about psychosis. So then the prodromal, becoming unwell phase. So the person has some changes in their emotions, motivations, thinking and perception or behavior as described in the box that we'll talk about later. So the prodrome cannot be diagnosed and is only identifiable in retrospect. And I think this is really important, okay? And I think this should be why Lindsay Clancy is found guilty in this criminal case. What was being reported, what could be seen as her effect, and that sort of thing, okay? So let me read that again all the way through. Prodromal, becoming unwell phase. The person has some changes in their emotions, motivation, thinking and perception or behavior as described in the box below. The prodrome cannot be diagnosed and is only identifiable in retrospect. During the prodromal phase, it may be uncertain whether the person is developing a psychotic disorder or another more common mental illness. In the acute phase, so the psychotic phase, the person is unwell with psychotic symptoms such as delusions, hallucinations, disorganized thinking, and reduction in ability to maintain social relationships, work, or study. And recovery. This is an individual process the person goes through to attain a level of well-being. Relapse. The person may only have one episode in their life, or they may go on to have other episodes. Some people have a single episode of psychosis. However, most people experience some people have a single episode of psychosis. However, most people have multiple episodes with either full recovery between episodes or partial recovery between episodes. Around a third have a continuous illness. Common signs and symptoms when psychosis is developing: changes in emotion and motivation, depression, anxiety, irritability, suspiciousness, blunted, flat, or inappropriate emotion, change in appetite, reduced energy and motivation, changes in thinking and perception, difficulties with concentration or attention, sense of alteration of self, others, or outside world. So that's feeling that the self or others have changed or are acting differently in some way. Odd ideas, unusual perceptual experiences, for example, a reduction or greater intensity of smell, sound, or color. Yeah, I remember that. Changes in behavior, sleep disturbance, social isolation or withdrawal, reduced ability to carry out work or social roles. Although these signs and symptoms may not be very dramatic on their own, when they are considered together, they may suggest something is not quite right. It's important not to ignore or dismiss such warning signs and symptoms, even if they appear gradually and are unclear. It should not be assumed that the person is just going through a phase, or that they are misusing alcohol or other drugs, or that the symptoms will go away on their own. And that's another thing too, part of this criminal case, I guess, and it will be part of civil, is, were the drugs themselves causing the psychosis and pushing Lindsay onto a psychotic episode? Just the mere withdrawal from drugs, because drug withdrawal can induce psychosis. The signs and symptoms of psychosis may vary from person to person and can change over time. It is also important to consider the spiritual and cultural context of the person's behaviors, as what is interpreted as a symptom of psychosis in one culture may be considered to be normal in another culture. In some Aboriginal communities, and we're talking Australian Aboriginal communities, for instance, being visited by spirits or hearing the voices of deceased loved ones are normal experiences. And that's something that really murkies people getting help and everything in psychosis in some cultures. Yeah. People experiencing the early stages of psychosis often go undiagnosed for a year or more before beginning or receiving treatment. A major reason for this is that psychosis often begins in late adolescence or early adulthood, and the early signs and symptoms involve behaviors and emotions that are common in that age group. For 65% of people with psychosis, their first episode occurs before the age 25 years. Many young people will have some of these symptoms without developing a psychosis. Others showing these symptoms will eventually be diagnosed as having one of the following disorders, and then it will go through, schizophrenia, psychotic depression, bipolar disorder with psychosis, schizoaffective disorder. So, that might be someone with, they might not fit, say, bipolar, but they've got symptoms of psychosis, and they've got various traits and things. Drug-induced psychosis and that sort of thing. And then interventions for psychotic disorders. But, so there's a lot of things, a lot of variables and a lot of things complicating Lindsay's case. I'm not saying I am not unsympathetic, and it is, it's possible that this was her first full-blown psychotic episode, and maybe she did. I just need to know, when did she come in and out of that first episode? was what she was experiencing when she took herself to the ER at the Massachusetts General Hospital. We don't know enough about that day and why she went there. Was that prodrome, or was that the serious crunch time? And then 3 weeks later, she's having this full-blown psychotic episode where she's killed her children. She says that she hadn't heard that voice before or since. Before that, she is describing intrusive thoughts, okay? That's important. She was describing intrusive thoughts, and they are horrible and they are scary. But she wasn't describing, psychotic episodes. But did she go far enough in describing things? Was there something to do with Lindsay being a nurse where it was taken for granted that she would understand a lot more and would be a bit more forthcoming? Were they not taking into account, this power threat meaning model, where what would that mean to Lindsay as a nurse, to, what's at risk for her to lose? Yeah, I guess I'll just have a look at this chart that I was writing up here. But honestly, this is a bit old. I've gone a little bit past what I've written here, but might as well just read through this and then I'll get going. So I do think, yes, she was in serious crisis. Deemed not to be psychotic, but, was she psychotic or not? This is what's really up for debate. And the thing was that she wasn't diagnosed with bipolar at the time. So was this a mistake? She wasn't taken seriously enough by Patrick, I don't think. I think some people just don't do depression. They just don't do anxiety. They just don't do a lot of things because they have a different worldview. They don't feel the same threat in their life. Their power isn't being threatened. He felt secure. He was struggling. He probably felt very anxious in his own way, or concerned. But he enjoyed his life. He wanted Lindsay just to get better and move on with things. And I guess he's saying, for all intents and purposes, he was being helpful. He supported her trying to go and get help. But did he press enough did he say to the health team, she has expressed homicidal thoughts? It's not up to him, but at the same time, who else can do this for Lindsay other than her husband? Okay, he's there day in, day out. His family are coming and going. They lived closer. And Lindsay, she expressed that she was not close to his family. They didn't really, she didn't think they really dug the kids, so to speak. They didn't ask to babysit and she didn't ask them, that type of thing. I think she felt there was a bit of an arm's length relationship there. It was not intimate, in certain ways. Not to say that they didn't get on and that they weren't close as a family with regards to spending time together, them being part of the lives of the children and that sort of thing. But Lindsay's parents lived further away, 2.5 hours away, and the mum had just been for a visit. So Patrick didn't feel the same abandonment or emptiness or change in his life. His work remained the same. He hired a nanny who was a lot of the time there helping him when Lindsay was trying to go back to work. And I think one nanny, though, was there for the 2 months leading up to her aim of going back to work after Callan. And then when she wasn't going to go back to work, then and they couldn't give the nanny enough work, she left. But in his mind, in someone's mind that's not having the same feelings, that doesn't feel the same threat, it's very hard to understand. He could try to intellectualize it, but he couldn't really feel it. Okay, so So, are the prosecutors going to lose the jury? They did actually have a pretty easy case, really, with regards to Massachusetts law, and they just needed to show that regardless of what was going on, Lindsay understood that this was wrong and she shouldn't kill the children. But, the prosecutors are very unlikable. For as much as I dislike some of how Kevin Reddington conducts himself, because he's sometimes just, he's so frustrating, but he's a lot more charming, and because he's the age that he is, he can get away with saying a lot of things, let's just say that. But the prosecutors are very unlikable, and they seem very cold, when because they so trying to put their points across. They called copious amounts of witnesses from the pool of first responders that attended the scene, tried to save the children's lives. That is trauma that those workers will take with them forever. Filicide isn't that common, and that might be the one and only time in their career that they go to that type of event. And she was very cold and dismissive with them, right? But they think they're doing one thing and they might be doing another. As PD Questions says, motherhood wasn't maybe something that was natural or manageable for Lindsay. She was too stressed, and sometimes people just have to accept that they're not going to be as good at things as they hoped, because they're just a certain way with life, and that's very hard to accept, and it's hard to just let go, loosen up, and just have that trust and faith that things will be all right. And that's rough. So now, what have I written here? It was not just one, but several practitioners who did not diagnose Lindsay with psychosis. She was depressed and anxious. Will the 4-week versus 1-year time frame for the onset of psychosis in postpartum matter to the jury? As I've said before, the laws in some Commonwealth countries are that if a mother murders their child and the child is 1 year or under, then it's an automatic manslaughter charge, not murder, because it is assumed that there has to be some sort of postpartum psychosis for this to occur, or at least postpartum mental illness. The Seroquel was working for sleep with Lindsay at some point, because she was writing in her diary through December, slept well on 100 milligrams, slept well on 200 milligrams, but, was still having intrusive thoughts. And that does go a little way toward bipolar, because it should have helped her. Seroquel is given with the SSRIs when people are bipolar, because it has to be to offset, for example, the possibility of mania, manic episodes. Was Lindsay Clancy being truly honest with healthcare providers? Because we need to give them a break with regards to the reporting from the patient. They can observe, they can get a history. If Lindsay gives permission for them to get records, they can get records. But what did she say to the Women's and Infants Hospital, the Women's Behavioural Centre? We're going to learn that hopefully soon. We're still just up to having Dr. Tufts go under cross. Just with regards to Dr. Tufts and her experience, people say, oh, she's a child, she's a girl, how pathetic, she was freshly qualified. Well, a psychiatrist, they are a medical doctor, so they've done whatever years, is it 5 years of study to become an MD, 4 years of residency, okay, 4 years of residency. That's what she was out of. And then she was fully qualified, fully fledged. She had the training, she had the qualifications, she was okay to look after Lindsay, whatever people think. There's the personal thing that comes into it too, her as a person. But as far as qualification, it is not an argument. So how open was Lindsay, with these places, and was Patrick insistent enough? When he's not attending appointments, could that have been a problem? And when he was attending appointments, maybe being there on a telehealth call, was that subduing Lindsay and being able to speak openly? And I'm sure that Lindsay was very, very concerned about power, threat, and meaning in her life, what it would truly mean to open up. And women are not only just, would I be able to return to work? Will I lose my family? Will I be able to keep caring for my children? What's going to happen if I open up? Will I just get help, or will I be further unempowered? Is that the word I'm looking for? I lose, I lose my words sometime. In Lindsay, here we've got a labour and delivery nurse who herself had 2 very difficult births. So, and was very overwhelmed as a mother. How was that playing into Lindsay's thinking about her worth as a labour and delivery nurse, and how she'll be judged and things like that, So with Cora, we know that she had some tearing. It was terribly painful, and she had a lot of healing to do physically, and that affects probably how you can mother your child. And then with Dawson, she had a breech birth, incredibly painful, difficult birth that took a lot to recover from physically, and she really should not have another child after that. But she's gotten pregnant and given birth, and this was a deep concern for her after Callan, because she didn't want to get pregnant, so she didn't want to have sex with Patrick until she had taken care of birth control. And so she was worried about their relationship without this intimacy. So yeah, it's really a tough one. But I just wish to God she'd stayed in McLean, not felt the pressure to come out. They should have just put off that party if she was worried about not being there. I mean, Cora was going away skiing with Daddy anyway, and they can throw a party. Kids have a different feeling of time, and it would have been okay to just say, hey, we're just going to do this at a later date, and have Lindsay stay in hospital. Maybe she would have had a psychotic break in hospital. Maybe she would have gotten better to the point where she wouldn't have. She was sleeping in McLean because she only had herself to think about. She didn't have to worry about the children. She wasn't worrying about her husband. She wasn't ruminating and overthinking about all the different things she had to do in the morning, and to manage everybody's different schedules and things. And people find that hard to believe because they think, oh, I can't sleep in hospital, but they're not in the same boots, are they? So, was that sort of thing enraging to Lindsay as well, or feeding into her feeling of big changes in life? Why is life going along the same for everyone else, and it's just me not coping? And psychosis comes along to save you from that. Okay, so what are the problems, or who are the things in life that are just sailing along without her? Her husband and her children, what did she want to repair? Her relationship with her husband. What was getting in the way? The children. Oh, it's terrifying to think that, regular people get into these situations. Obviously there's a lot of people thinking about Patrick being the murderer and framing Lindsay and, being the voice in her ear. Kill the kids so you can kill yourself. Pushing her face first out the window. Maybe taking her phone with him. I thought about that. How was the call done? Well, maybe if CVS is close enough and he knows where the cell towers are, it would ping off the same tower at the CVS as it would at home, and so he could just have the phone in his jacket pocket. Does he put his hands in his pocket and maybe make a call from his phone to his phone and pretend to have a 14-second conversation, you know. I want to know why she took off her Ugg boots, because she wouldn't have to take them off. I mean, it's looking like she did go face first out that window, to be honest, but but I can't get over taking the Ugg boots off then. Why take the Ugg boots off if you're not wanting to get a little tippy-toey, grippy-grappy on the little window ledgy that she could easily reach, and then to push off and jump down from, you know. Why take the Ugg boots off? I'm not sure about that. Why was the Apple Watch in the dresser, people are saying, you know, they say, why wasn't it put onto Lindsay's wrist? Does the Apple Watch show her going up and down? Did she take it off and just put it into the drawer, thinking she'd lay on her bed and die of blood loss, and just put the Apple Watch away in the drawer just because that's habit, and see the Seroquel that was in there and take the Seroquel? But how did she get up and crush the Seroquel, you know, without leaving blood there? And you know, so I hope we learn the order of events of things. People are talking a lot about the DNA not being on the bands from her, but being of Patrick and being of the children on each band, and I've got to look into that further, so I'm not going to talk about that at the moment because I'm not clear on it, and I need to know what the meaning of everything is. But, you know, obviously it's easy for Patrick to fake and lie about what was said, you know, because how did she talk? Like, how did she talk if she's out of consciousness and she's taken all those pills? She couldn't talk to the first responders. And how did she say to Patrick, they're in the basement? And then how is she 5 minutes later in such a state when the first responders? That just doesn't make sense. And why hadn't he already found them in the basement? And, you know, there are things that true crimers see in here that, you know, scream of hoax, but it might just be because we just really don't have a clear timeline. I don't think any one of these people in the court have done a good job of laying that out for us, and so I need to personally do a lot of work on timelines just for myself. When would she have crushed the pills, taken the pills, before or after harming the children, killing the children, before, you know, and at what time frame? And was she only just able to speak? You know, she's got in hypothermia, so she must have been laying out there in the snow, surely, longer. You know, so that I can see how people want to make up, you know, maybe just Patrick wanted to wipe a slate and start again, and he certainly did. And he is very cliched in what he says about his life and wife and the kids and everything at that time, you know, and he just, yeah, he seems, yeah, I don't know if but it's all too easy just to make all these judgments, isn't it? And with just these very brief explanations of and little bits of information. Yeah. So look, if this was just a rageful and a disgusting thing to do, something just really coming out of huge resentment, you know, to lose control as a mother to the extent that you murder your babies. I mean, Lindsay has to be held accountable. And, you know, the health workers, she was saying, no one is a bloody mind reader, okay? No one's a mind reader. So they do rely on clients to be truthful. And is that the bottom line? I'm not sure, but I wasn't sure for a long time if this was a psychiatric break, you know, a psychotic break or a psychotic episode. And, you know, after I learned she sort of survived the window fall, and I mean, Sorry, I'll just try and wrap this up and think clearly about what I thought again. So hearing she jumped out the window, I thought, okay, no, she's just really lost it. And or is that an act of, despair, becoming aware of what she's done? When in fact, with psychotic episodes, you really don't know what has happened. Some people, that is blanked out, and just, you can go and read the case studies of people, some of whom I've mentioned on this channel to do with Lindsay's case, but they don't have a recollection, and hey, I would like to know, is it really that Lindsay didn't have a recollection and she's been told what happened and told what she said to Patrick and told what she's done and she doesn't remember it? I mean, wouldn't that be curious? But, and then thinking about it and thinking about her surviving and just looking at the window she jumped out of and everything, I started thinking soon after that, look, I'm not sure, was this harm to herself unintentional? Thinking about the cuts and things like that. In distress, look, it's very hard to cut your own throat, okay? Because, your everything, it's not natural. So your brain will fight you on that one, okay? Very, very difficult. Which is why some other methods are chosen by people, because they know it will just happen. So they jump off the Golden Gate Bridge, to be morbid. But a survivor of that actually has said that, yeah, as soon as he did it, he regretted it. Yeah. So, there is that. And what, the pills she took weren't enough to kill her outright either. Were they to numb something that she planned to do, and she knew the time factors, so crush the pill, take those, I'll have time to do this role and this action, and then I'll go and do this, and so by the time I get to that, I'll be able to go out the window. But then, you're going to be drugged up and not really able to control your fall, and did it affect her more than she thought? Yeah, and she did end up just sliding out the window face first, flipping over and landing on her back. Or the top of her spine there. Oh, yeah. It's a quagmire, isn't it? Well, that's nearly an hour, so I will off ski. We're going to have, as I said, the cross-examination of Dr. Tufts next. Not sure how that's going to go. Kevin Reddington was not very fair on Dr. Goodhart, I thought. I mean, to do with the DSM, TR just means text revision, and postpartum psychosis isn't its own subject in the DSM. It's not a diagnosis. It is a sub heading under psychosis, and she said nothing wrong. She knows her stuff. She's seen plenty of psychosis. She just hadn't seen a postpartum psychosis case. It is rare, but she understands postpartum depression. She understands psychosis. She did have the skill set and experience to recognize that in Lindsay Clancy, and she didn't. And that's that. So, yeah, what's everything going to boil down to, what the jury decides should have been done for Lindsay and who's culpable. Was she in a psychotic state, but, was it caused by the drugs or something that should have been recognized? I feel like if she was in psychosis, I'm not certain that should necessarily stop her from being accountable, okay? I do think she needs to be in hospital until she's well, so to speak. That could be 15 years, and then I think she needs to go to prison, but it's complicated because she is a paraplegic. She is paralyzed from the sternum down, so there's difficulty with that. But I don't think she should just be out, make money in a civil suit and go and live her life, because she has murdered those 3 children. Or has she? Yeah, might do a video on the Patrick theory. Yeah, who knows? All right, bye now.